Okay, guys, today we're going to talk about Cheryl Cox's integration model of client health behavior. So, what intrigued me about Cox's theory is how a patient's background combined with the interaction with the health personnel helps to shape their health outcome. Working at a county hospital, I'm faced with the same question Cox had when developing this theory. As practitioners, it also helps us individualize our care to provide better outcomes for our patients. In 1970, Cox got her BSN at the University of Tennessee. Then in 72, she got her MSN at Vanderbilt. In 1982, she got a PhD from the University of Rochester. And in 1989, she got her Certificate of Business Administration at the University of Chicago at Illinois. All right, so let's talk about the interaction model of client health behavior, some of the attributes that are a part of it or elements, and just kind of dig deep.
People make healthcare decisions based on their unique and individual characteristics.
Looking at a person's individual characteristics, we have to consider their background profile, which includes demographics, social influence, environmental resources, previous healthcare experience.
Health outcomes are determined by effective interaction with healthcare providers.
Another attribute in this theory is the environment, which includes your demographic characteristics, background variables, and your environmental resources, including, what kind of healthcare you have around, your money, the environment in general around you. Nurses influence patient health outcomes with effective interventions. You have to consider the professional or technical competency of the provider and approach to the provision of healthcare information. So how are you going to disseminate that information? And then also decisional control, giving a little bit more to the patient versus you just taking control of. Cox developed the theory to provide a client-focused framework that encompassed the following: client individuality. She wanted to address elements of client-professional interactions and the role in determining health behavior, and also guide the development of nursing interventions specifically tailored to the client's expressed healthcare need. She also provided a high-level predictive theory. Take a look at this picture view of the interaction model of client health behavior. It just gives you a good overview of how everything kind of interacts to create the health outcome that you want. Also, how you can individualize your care just based on the different elements. So now we're going to take a look and see what kind of contributions Cheryl Cox has made to the nursing community. She developed the model to inform advanced nursing practice and direct research relative to patient and provider that influenced behaviorally related health outcomes. The model has been the foundation for more than 24 National Institutes of Health studies, totaling more than 50 million in support. And her work has targeted health promotion and risk reduction in the general population and in pediatric oncology. Provides a client-focused theoretical framework of health behavior. The model helps to guide development of nursing interventions tailored to the individual client and their healthcare needs.
It helps determine the specific barriers to positive health outcomes for our patients and individualize our interventions. It has been utilized in specific populations to identify new determinants of health-related behavior like pediatric cancer patients and children of breast cancer survivors.
And finally, the theory encourages patients to take control of their health by providing nurses the interventions to push patients in that direction. For example, breast self-exams for children of breast cancer survivors.
So, tell me, how complex is the interaction model of client health behavior?
The IMCHB, with its multiple variables involved with the client-provider interaction and singularity, creates a complex theory. The theory itself is simple to use and apply, but there are multiple facets involved which could cause difficulty in formulating tests against the theory. The scope of this theory is very broad, and according to Carter and Kolbeck, the IMCHB model has a broad enough scope to allow the professional some degree of liberty in working with clients of various developmental stages and with varying healthcare needs. Due to the broad nature of this theory, it can be utilized throughout all of the nursing disciplines. It's been utilized in pediatrics and community health, geriatrics, Cheryl Cox's nursing theory relates to current nursing practice and perspective as well. We're constantly trying to provide better outcomes for our patients, and this theory allows us to create interventions tailored to the individual. Based on the individuality of outcomes determined from the previously mentioned variables, situation-specific outcomes can be prescribed and thus move us toward the goal of nursing, which is to prescribe. The IMCHB has a high value to society and the nursing profession due to the broad scope and interest in the health of the community. Hey guys, we made it to the end. Anyway, thanks for joining me on this journey through Cheryl Cox's life and her contributions to nursing practice as well as the future, also as well as a little look into her theory and interaction model of